Okay, so it is my pleasure to work with Dr. Rahi Sarbaziha. And she is a double board certified doc in Beverly Hills with like half your life in integrative medicine, fellowship trained, and the other half in aesthetics. And this is a rare combination.
Yes.
Yes. But since I know a little bit about you, I'm really intrigued by your personal journey and your personal story, because I know that, you know, to get to where you are now really took a lot of challenge, and so maybe you could speak to that a little bit. I know that, yeah, let's talk a little bit about what that's meant, because we have been focusing on some personal things. So I think there's a story that others can learn from and really admire the journey that you've taken. So talk to us a little bit about your journey.
Yes, I definitely wasn't expecting that, but I'll share a little.
I told you I was going to ask you questions you weren't expecting.
Okay. Sometimes talking about my story makes me a little emotional just because I feel that I've been through a lot. I was born in Iran, and I was born during the time of the Iran-Iraq War, and my parents didn't want us to stay there because obviously, not just because of the war, but also for women's rights. And I'm super grateful that I left because, you know, I don't think I could be doing what I'm doing right now if I lived there. We went from Iran to India, and we stayed there for 4 months. And from India, we went to Holland, and we stayed there for 2 years. And from Holland, we went to Canada. And I was basically raised in Canada from the age of 6 until I went to med school. And so growing up was, it was challenging because, you know, being an immigrant isn't always the easiest thing. Having cultural differences, my parents were very strict growing up. And, you know, when you come to a different country and you're already an adult, it's hard to really integrate. And sometimes I feel like my parents had the best intentions, but it was hard to, you know, release their daughter into the wild. But I knew what I wanted, and I knew that I wanted to be a doctor, and I knew that I had my vision of what I saw myself doing. And I visited California when I was 18 on a vacation, and I decided that that's where I wanted to live. And that's basically, I made it happen through all the adversity. So
all of that has, I would imagine, made you a stronger person, yes?
Stronger person. What I think it's made me is I'm very open-minded, and I'm very accepting of all types of people, because I've lived in so many countries, more than the ones I've mentioned. I've lived in so many different places as well, so many different states, parts of Canada. I feel that I can relate to almost any type of person.
Right. And who's your typical patient? I mean, who's the one? I mean, you know, you are a unique character with a unique practice. I mean, you're not the average med spa. You're not the average dermatologist or plastic surgeon. You are very unique. Who is that person who is drawn to getting care from you?
I think my patients, well, I have a wide range of patients, and I'm very proud of that too, because I'd say very multicultural practice. And, you know, that's partly because of who I am, and it's partly because Los Angeles is very multicultural. I'd say my patients are drawn to me because of the integrative approach to aesthetics. So I do integrative aesthetics as well as integrative medicine as well. So we do weight loss, wellness. And so I think it's really patients that want to participate within their own healthcare and want to be educated and also want to look better, feel better.
So you've been able, in a very congested market, I mean, you're in the LA market where I think by law there has to be an aesthetic clinic every 80 feet or something like that, and then they stack them up even. So, but people know, how do people learn about you? I know that you've got a very vibrant, outgoing personality. Where does that get expressed?
I think my outgoing personality is mostly outgoing at work, and then at night when I go home, I'm like, I can't do it anymore. But I use a lot of social media. I find that to be a really powerful tool, and if you can use it and just use it as a tool and think of it that way, it's really excellent. It's also free. So I love it, and connecting with other people through social media. Word of mouth is also probably the most powerful. It always has been and it always will be. Those are the two main ways that patients find me.
Yeah, I think word of mouth is still, I mean, people say, well, who should I go see? Oh, you should see my doctor. And you know, you've really distinguished yourself because you're a unique brand in the marketplace. Unique brand. So talk to me about the patient who comes in for aesthetics, and you talk to them about an integrative functional approach. What do you say? How well is that received? You know, what does that dialogue kind of look like?
Okay, let's talk about, you come in and you want to improve some fine lines and wrinkles.
Yes, I do. I actually do. But.
And so we'll go over, you know, what your goals are. Obviously, that's the first step, because if you just want it like a little bit softer, we can do some minor procedures. If you want to significantly, we'll come up with a plan every month to do something. So I like to combine procedures with supplements, lifestyle changes. I like to do a very thorough intake to really assess what medical history they have, surgical history, supplements they're on, medications they're on, what they want to do, what they're open to doing. And based on that, I like to come up with a plan that they're comfortable with.
Mm-hmm. And I know you are a leader in the use of peptides, and which is certainly one of the, we think about the emerging areas in treatment. So how do you incorporate peptides into your regimen? Who gets them? Who doesn't get them? What are they getting them for? Just kind of walk us through that, please.
I do like peptides a lot, and I think the use of them has been growing, so topical and injectable peptides. I've been doing a lot of the weight loss peptides, and I watch my patients very closely. I don't just hand them a vial and they disappear. I like to watch my patients very closely, and just educating them about what peptides are, how you can incorporate them into your skincare, post-procedure, right after the procedure, and some of the injectables like semaglutide, tirzepatide.
So many patients towards the tail end of their usage of semaglutide and the GLP-1 agonists, they're kind of wasted. They've lost muscle mass, they've lost a lot of fat, certainly. What's your protocol for helping that person, number one, not regain their weight, and two, on that regimen, how do we keep muscle mass and good healthy fat around?
I like to talk to my patients and educate them on, what the medication's used for, and if I feel that they're kind of getting a little too addicted, I might stop or tell them that they don't need this at this point and maybe suggest other things. There's certain supplements that you can go on that can help with appetite suppression as well. I always encourage my patients to work out. I tell them that, as long as you're getting your electrolytes, your water, you should still work out when you're on the medication. Don't overexert yourself. I recently hired a health coach, which I think is a really important part of my practice because, as doctors, we get really busy and we don't have the time to have longer conversations sometimes. And so the health coach is a great way for my patients to redo their whole lifestyle while they're on the medication so that when they get off the medication, then they can just continue the path. Because once you lose that weight, you shouldn't gain it back unless you're going back to the old ways.
Yeah. So I love the idea of the health coach because one of the things that we sort of need in healing is tincture of time, T-I-M-E. And there's really very little of you can't substitute the time spent educating, being in the presence of someone who's going to help you. And then, of course, we learned in the session that we're sharing now that since we're within 3 feet of each other, we are sharing our microbiomes, right? Our skin microbiomes. We're sharing the energy coming from our hearts and electromagnetic rays. There's an art to the consult, isn't there? And if you had an intern following you around, one of the universities gave you an intern, and they were going to watch you do a consult, what would they see?
Um,
What would they hear?
Yeah, so when my patients come in, obviously we ask over the phone, or if they book online, why they're there. I walk in and I introduce myself. I say, welcome to the office. How are you doing? And I usually start off by what brings you in. If it's something related to weight loss, we'll go over all the options that I have, because I don't just do peptides for weight loss.
Sure.
But, most people do want the quick fix. But I do go over all the options, go over the fact that I need labs, really try to get to know the patient and their goals and how much weight they want to lose. And so that's usually how a consult usually starts with me.
And then who discusses prices? Who discusses the options? Do you talk about that, or do you send them to a coordinator for that?
When I first started my practice, it was just me, right? And so obviously I'd have to talk about prices. And I realized that the best thing is for me not to do that, because as the provider, when you start talking about pricing, it just, people start negotiating and it's just becoming very uncomfortable.
Yes.
And you don't want to be involved in that as the provider, because you just want to be disassociated from that. And so I have an operations manager now that does all the price talking. Even though I know what all the prices are, I still say, I'm not 100% sure, let me clarify that. And they'll go into the room and talk to the patient.
Got it. Yeah, that really makes a lot of sense. It's so challenging at first because you don't want to be in that position where you're negotiating a lower price with your patient.
I just I don't know why that is, but it's a thing.
Yeah, it is. It definitely is. It's a real thing.
Well, people don't go into Louis Vuitton and start negotiating with the sales rep, but why do they negotiate with me about a syringe or filler?
Yeah. Which is much more important for their beauty than that Louis Vuitton bag.
I know.
Have you had success getting people to change their diet and the way they eat? And if so, what are the kind of tips that you might be able to share with fellow practitioners?
Yes, definitely. I think the first step as a practitioner in the world of integrative aesthetics is to practice what you preach. So to kind of represent the brand and represent, the wellness. And so that's one step. And then I like to just educate people on what is considered processed food versus non-processed foods, and how to start eating healthier. And I like my patients to give me a 7-day food journal. They don't always do it. It's tricky. People tend to forget, but I like to really, because if you ask someone how they eat, they always say, I eat great. You don't want to insult anyone or offend anyone, but you just want to educate them. That's the best way.
So I'll tell you a funny story, just as we're talking. Years ago, I wrote a newspaper column for the Seattle paper, and I was stuck for a column idea. I went to my editor, said, if I ask people to keep a 3-day dietary record and send it in, I'll evaluate it, how many do you think we'll get? And he said, well, 50, 60 max. So I said, okay, I'll do it. Thousands of them poured in. My mistake that I learned was, if you're going to do that, ask people to put in a $5 bill. That would have cut it down. But it does show me that way back then that people are interested in the guidance. When we do ask people to do recalls sometimes and 3-day dietary records, sometimes they make themselves look too good. Mm-hmm. But even that's not such a bad thing, because at least they're thinking about it. So I think you're right, that first step is introspection for sure. In one of the other sessions we talked about supplements and the importance of supplements. How do you decide who gets what? I mean, should we all be taking the same supplements? Do you need something? You need something? You need something different, I know that. So how do we figure that out?
In the ideal world, we wouldn't need supplements. Our food would supplement our diet and our needs, but it's not like that. But in the ideal world, I would like to place everyone on magnesium. Vitamin D is one of my favorites. However, I have to say that some people just don't want to take supplements. Like my father is an example. He thinks that supplements are a joke and he won't take them. But so you have to assess the patient, see what they're willing to do. If someone's like only willing to take one pill, then maybe just put them on a multivitamin.
Sure.
And some people are open to taking multiple, supplements. They just need help and guidance, and they need to come up with a plan. And so I base it on their medical history, their labs, and their goals. And
Sure.
yeah.
Yeah, it's well, first of all, my daughter's never listened to me either, so your father hasn't listened to you. We can't be prophets in our own land, that's for sure. Interesting. So what else would you want people to know about you, your practice, the kind of work that you do that we haven't talked about?
What else do I want people to know? I recently moved offices, so I'm very proud of it. To me, it's a big deal because it's a storefront office, and I literally started in a room like smaller than the stage. I was telling actually Dr. Sunil earlier. I started in a tiny, tiny room, and I had no idea how I was going to start it. I just knew that's what I wanted to do, and I just kind of went with it. So I think my biggest achievement right now these days, what I want everyone to know, is to come visit my new office because it's beautiful.
Absolutely. So you are certainly a risk taker. It's in your DNA to overcome, to be resilient, to be brave, and that's a very nice thing. And so I do need to get there and visit. And so for this episode today, we want to thank you for joining us.
Thank you.
Dr. Rahi, real pleasure.
Thank you.